Dear students and parents, I, Rupal, on behalf of Kemudevi Public School, presents a small video to spread awareness amongst each and every individual about the vector-borne diseases such as dengue, malaria, and chikungunya through social media during COVID-19 as per the guidelines issued by Directorate of Education. So, we are going to explore and we are going to know about these vector-borne diseases discussed over here. In this presentation and in this video, we are going to learn and explore more about the vector-borne diseases such as dengue, malaria, and chikungunya. So what is a vector-borne disease? First we get to know that what is a vector-borne disease. This is a viral disease. Viral disease means that it spreads from one person to another very easily. That means it is a transferable disease. Second, it is transmitted by the infected bite of Aedes aegypti mosquito. It is a mosquito through whose bite you get this vector-borne disease. The name of the mosquito is Aedes aegypti mosquito. Men develop this disease after 5-6 days of being bitten by an infected mosquito. So when this mosquito bites you, it reacts after 5 to 6 days. It takes almost 5 to 6 days to get you in contact with this disease. Also, how do you know that you are suffering from this kind of a disease? So it comes in the form of a fever, or you feel like your body is paining. Also, you will feel like a high dengue fever and a flu-like illness in your body. There are more few severe diseases like dengue hemorrhagic fever (DHF) and chikungunya is a more severe form of disease which may cause death also. So this DHF and chikungunya are more severe form and they may lead to your death also. Also, a person suspected of having chikungunya or DHF must see a doctor at once. If you feel like high fever and this kind of symptoms are there in your body, you should consult to a doctor once. So now what are the various signs and symptoms of vector-borne diseases? You are suffering from this disease. How will you judge that you are suffering from such kind of a disease? So what you will feel in your body is abrupt onset of high fever. Onset of high fever means your fever is like it has 101 degrees, 104 degrees, and it could go more above than that, and it does not reduces. So that is onset of high fever, and in that condition you should consult to a doctor. Severe frontal headache means you'll have a high headache and it won't go easily, and so when you have repeatedly headache, everyday headache, so also in the same condition you should approach to a doctor. Pain behind the eyes which worsens the eye movement. So this is one of the sign and symptom. Whenever you feel like your eyes are paining and when you're moving your eyes here and there, and that movement is also causing the pain, so that means something is wrong, and or you have been in contact to this disease, so you should consult to a doctor in this case. So few other symptoms and signs of these waterborne diseases are like muscles and joint pains. Your body starts paining a lot. Next is loss of sense of taste and appetite. This particular symptom we face during coronavirus time also, that you lose your sense of taste, you do not get taste of anything, and appetite, that means the consumption of the food according to your body reduces down. So this is one of the symptoms you face during the waterborne disease as well. Next is measles, like rash over your chest and upper limbs. You get red patches all over your body, especially over your chest and upper limbs. And nausea and vomiting. Nausea means nose bleeding, and vomiting are these few symptoms which you face during this vector-borne disease. symptoms is similar to the dengue fever. Dengue fever is actually a very high fever. So in case you are suffering from a dengue fever or a high fever, you should actually consult to a doctor. Also during this time you have a continuous stomach pains. That means if your stomach is paining continuously, you should go and consult to a doctor. Skin becomes pale, cold or clammy, and this is one of the main symptoms of malaria. When your skin becomes pale, cold and clammy, and malaria is again a vector-borne disease. Bleeding from nose, mouth and gums and skin rashes. This is equivalent to nausea, and gums and skin rashes also leads to this disease. Frequent vomiting with or without blood. This is also important, you have to keep it in mind. Sleepiness and restlessness. You will feel like not doing anything throughout the day. You will feel sleepy and your body will be restless all the time. Patient feels thirsty and mouth becomes dry. You will always feel like drinking water after every minute, and your mouth will stay dry still after drinking so much of water. So this is again few symptoms here shown to you. Rapid weak pulse. Weak pulse means that your heart rate goes down day by day or minute by minute or hour by hour. Your pulses, heart rate goes down, and so you need to consult to the doctor. So you need to approach to a doctor because this is the severe problem. Difficulty in breathing. You face difficulty while breathing as well. Here is some data shown in this, where blue part shows the cases and the red linings are showing you the death rates in different years, how the cases have increased in few years and how the cases were almost equal to no or few cases in few years. So this is the magnitude of the problem of this vector-borne disease during few years, and it is the data till up to 2010, up to the month of May. So you see that death rates have reduced. That means this disease is treatable. We can treat this disease. So we should not create any panic when if we are suffering from this disease. So period of communicability, like how does this spread? What is actually happening? So infected person with vector-borne diseases become infective to mosquitoes in 6 to 12 hours. After biting, what it is saying is after biting of the mosquitoes bite or the mosquitoes stung which is left in your body reacts in 6 to 12 hours. And then that reaction of that stung or that reaction of that mosquito stays in your body for 3 to 5 days, and then that period of 3 to 5 days is very miserable because you can spread this disease from one person to another. Actually, it is a communicable disease. So how does this mosquito basically breathe, or how does it take birth? Why this mosquito is spreading so much? Because deserted coolers, drums, jars, pots, buckets, all these given things, refrigerated drift pans, cement blocks, cemetery urns, bamboo stumps, tree holes and many more places where rainwater collects or is stored. In all these places, this mosquito is breeded, or you can say the birth of this mosquito happens where the rainwater collects. Not only the rainwaters, whenever the water has been collected for much more time, you have to remove that water from that container and fill it with the fresh water. No stale water should be stored anywhere because it gives birth to the mosquitoes, and then this disease spreads widely. So when we are in contact with this disease, so what can be the treatment? First, we have to keep in mind that prevention is better than cure. It is already an we have to always keep this in mind that we should be always preventive. But in case when we are around this vector-borne disease, so there are no drug or vaccine available for the treatment. First of all, we have to keep this in mind. So because there is no vaccine or drug, so we have to be more careful. So the control of Aedes aegypti mosquito is the only method of choice. That means we should not give a chance for the breeding of this mosquito, and if the breeding will be stopped, we can fight against this vector-borne disease, and we are only responsible for the breeding, because if we won't keep the stored water around us, this problem will be rectified, and with early detection and proper case management and symptomatic treatment, mortality can be reduced substantially. That means if we have detected this already and we have the management for that, so we can reduce the death rates substantially, means that we can do better with this detection and case management. There are a few do's and don'ts which we have to keep in mind so that this disease not spread widely. So what are the various do's and don'ts? Remove water from the coolers and other small containers at least in a week. So the water which you have stored on the various places in the small containers or in the coolers, you should keep on changing that water on the regular basis or at least in a week. Use aerosol during daytime to prevent the bites of mosquitoes. So you should use some kind of repellents or use some kind of aerosols or some creams so that you can prevent the bite of mosquito. Do not wear the clothes that expose arms and legs. So you should wear all covered clothes during this time. Our hands and legs should be properly covered. Children should not be allowed to play in shorts and half-sleeved clothes. So again, it is repeating the same point that we should wear properly covered clothes, and whenever we are going out to play, no, we should not wear half-sleeved clothes. There should be full-sleeved clothes and full pants with us. Use mosquito nets or mosquito repellents while sleeping during daytime, and whenever we are taking a nap during the daytime, we should be in the mosquito nets or we should apply mosquito repellents on the body so that mosquito does not bite. Do not keep water container open as they can attract mosquitoes to breed. So wherever you have stored the water, you should not keep that container open because it can attract the mosquitoes and they can breed over there. And do not create panic. That means if this disease is around your area, so you should not panic. You just have to keep few points in your mind that what is giving rise to this disease, and do not do those things and it will be okay. Cover the toilet seat if going out of home for more than a week, and if you're leaving your home for more than a week, do cover your toilet seat, because then again it is one of the way to breed that mosquito. So GOI, Government of India, initiatives for dengue and chikungunya. So our Government of India has taken some initiatives for all these vector-borne diseases, and two of them are discussed here. There are many of these initiatives taken, but two of them are mentioned here, that developed a long-term action plan for prevention and control of dengue in the country and sent to the states on January 2007 for implementation. So this long-term action plan was implemented in 2007. The other initiative was National Guidelines for Clinical Management of Dengue Fever and Dengue Hemorrhagic Fever. Dengue shock syndrome has been sent to the states in April 2007 for circulation in all hospitals. So these national guidelines were issued in April 2007 and were circulated in all the hospitals. So besides these two, there were many other initiatives taken by the Indian government. Two of them are mentioned here. So here at the end and at the last, I want to say that dengue, chikungunya and malaria are treatable. We can treat these diseases with ourselves only, and what we need to do is we just do not have to panic and keep ourselves aware about all these things. We should not store water for so long around us. We should wear full sleeved clothes and full pants. We should keep our body covered. So these are few preventive measures we should take so that we are not around these vector-borne diseases. So I take your goodbye. Thanks for watching my video. Thank you everyone.